Today is the 28th annual National HIV Testing Day, when people are encouraged to get tested, know their status, and get the care and treatment that they need. Valley News Team's Kirsty Madej explains more about options and why it is so important.
It's been 35 years since he died, and I still feel it in my heart.
Joe Larson started dating his boyfriend Steve in the 80s, at the height of the AIDS crisis. At the time, the disease was spreading rapidly, and many were dying.
He never thought he would be in a relationship, and it meant so much to have someone who loved him just as he was.
When Steve and Larson met, Steve was already diagnosed with HIV. And as the relationship moved forward, Steve had to tell Larson.
I knew it was a big deal for him. And I know for some people, especially here in North Dakota, that's still a big deal. Disclosure can be scary, and it was scary for him. I think for him, he was afraid that I wouldn't want to see him again.
I think it's a stigma. I mean, unlike having a common cold, which is also an infection, you don't feel bad letting people know, oh, I caught a cold.
Dr. Ayi at Essentia says the stigma surrounding the diagnosis is what prevents many from getting tested. She says, hypothetically, if everybody got an HIV test in one day and learned their status, the disease could be completely eradicated.
The CDC recommends that everybody between the ages of 13 to 65 should at least get one test in their lifetime. I mean, know your status.
Larson hopes that with the advancements made in the medical field to combat HIV, it will be less scary for people to get tested.
And it really felt like a death sentence. And people who test positive today still probably feel that way, but there are options now.
Reporting for Valley News Live in Fargo, Kirsty Madej.
There's also fear of possible criminal prosecution for those diagnosed with HIV. According to North Dakota law, it is a felony for anyone to, quote, transfer body fluid that may contain HIV. Officials say the law, enacted with good intentions, is now keeping people from testing and leaving many North Dakotans undiagnosed.